Marge Rattel met with Dr. Mauli and key administrative personnel at the University of Cape Coast and the Cape Coast Teaching Hospital to discuss critical care nursing and how to support neurosurgery. The UMCA Foundation worked together with the Ministry of Health to distribute supplies to over 20 different hospitals and clinics in the Korle-bu district. As part of the 2020 shipment to Ghana, KBNF was able to provide a hospital in Kumasi with the first baby warmer for the entire region.
The baby warmer, which is the only one in the district, serving over nearly 70,000 people, and the district is huge. Just to give you a size of it, it's 1,600 square kilometers. And it's the only one. And they actually built a special enclosure for it. And I think I sent you some pictures with the babies, and I think we had 2 sets of twins. They came in. So it's about, let's say, about 50 kilometers east of Kumasi.
Even major hospitals are limited in the number of surgeries they can perform by a critical shortage of surgical tool sets. KBNF board member Dr. Harry Akoto is a neurosurgeon at Korle-bu Teaching Hospital. He sat down with Marge and the team to discuss how KBNF can help support hospitals in Ghana with this issue.
Alright, so my name is Harry Akoto. And I'm a neurosurgeon in Ghana. I think as humans we are created to help each other. The life we lead is not for ourselves. If we were to live life for ourselves, we would give birth to stay in the same spot, grow, die. But that is not life. Life is reaching out to other people in any way possible. So for me, what I know how to do, it's surgery. I may not have the funding to pay for people's surgery, but I have the ability to do that for free. And for me, it is the least I can do to help humanity. Well, I mean, the needs are massive. Even in Ghana, where we have a fair amount of neurosurgeons, we are inundated with cases. We are never able to do enough, especially when it comes to the high burden of trauma and infections. To practice good neurosurgery, you need tools, okay? And you need really expensive tools most of the time, which our governments unfortunately are unable to provide or refuse to provide. It is good, and that is where I think KBNF does it. At least sourcing for some tools and then using available human resource across the globe to meet that need, I think is a laudable idea.
On October 26, 2021, a container was shipped from Vancouver containing an OR table, stretcher, examination tables, hospital beds, and other medical equipment and supplies for a small hospital in Shira. It's scheduled to arrive on January 2nd, 2022, and assist in providing primary care to the community in the surrounding area. Before touring the hospital, the King and Queen Mother formally welcomed and thanked KBNF for our community support.
And I want to encourage you today that our foundation partners with champions. And when we hear stories that how you built your hospital, right, that's the first thing that was here. And then you've grown a community around it. Oh my goodness, that is precious. And so we are looking very much forward to you receiving your container.
And so we are so happy that you have come, and then we wish you well. And I think this is the beginning of good things to come in the future. So you are warmly welcome, and we are so happy to see you. Thank you.
Well, we're at the University of Ghana Medical Center, and this is a project that our foundation embarked on years ago, like 2007, 2008, 2009. And from that, what it did was inspired the government, which approved the plans that we promoted in terms of building North American standards. So this is the first hospital built to kind of standard in Sub-Saharan Africa. So this is the emergency wing, and they have full radiology in there as well, and we're hoping to be able to show pictures of that. In the Women and Children's Center, they have a training and simulation center. We were also the first foundation to work on training neurosimulation if it ever happened in the world, and we partnered with the Canadian government and pulled that off, and it was wonderful training how to take certain brain tumors out. We're going to be meeting with Dr. Teddy Todema, he's the chief of neurosurgery, and what he has informed me is that there's desperate need for trained neuro nurses, critical care, high acuity nurses. And so what we're envisioning is building a training program in partnership with the Utah College of Medicine and take it forward from there. And it won't just be for this particular hospital, it will also be for West African nurses. Neuroscience nursing is the most special because you are the eyes, ears, the everything for that doctor. And if you really do your job well, you advocate for that patient, you can save their life and they can go home and have a full productive life.